Hola, muy buenos días a todos. En un minuto, en breve, ya
Good
estamos.
morning, all. We will be starting our session in about 1 minute. We are waiting for other journalists to join us, and we will begin then. Thank you.
Ahora sí, entonces, ¿qué
All
tal?
right. Good morning, everyone from Washington, D.C. Thank you for joining us to this press briefing of Pan American Health Organization on the COVID-19 pandemic in the region of the Americas today, March 8, 2021. I am Sebastián Oliel from the Communications Department of PAHO. Our session will last 1 hour. We will take your questions up to that point. We have received questions via email, and you will have an opportunity to ask questions live and through the chat and the Q&A buttons. Please include your name and the medium you represent when you send your questions. Also, we have simultaneous interpretation into English, Portuguese, French, and Spanish, and you will be able to reach that if you click on the globe called interpretation. Dr. Caísa Etienne, Director of PAHO, will give you an update on the situation of COVID-19, the vaccines, and PAHO's role, and the revolving funds role as part of the COVAX facility. Dr. Etienne is accompanied today by Dr. Jarbas Barbosa, Assistant Director of PAHO, and Dr. Sylvain Aldigueri, Incident Manager for COVID-19. Now I would ask Dr. Etienne to share her words. Dr. Etienne.
Good morning, and thank you for joining today's press briefing. As of this week, the Americas have been home to nearly 52 million cases and more than 1.2 million deaths from COVID-19, with more than 1 million of these cases reported in the last week alone. The United States, Canada, and Mexico are continuing to report a drop in new infections despite localized hotspots in the U.S., the state of Virginia, and none of it in Canada's Northern Territories, which is home to many indigenous peoples. Across Central America, countries are experiencing a decline in infections, although areas of Guatemala and Panama's indigenous province of Gunayala are reporting an increase in cases. In the Caribbean, larger islands are continuing to see a drop in cases, while Cuba, the Bahamas, St. Lucia, and Guadeloupe are seeing a rise in infections. In South America, Paraguay, Uruguay, and Chile are reporting an increase in new cases. And while Peru and Bolivia are finally seeing declines, infections remain high. Cases are on the rise in nearly every Brazilian state. And over the last week, the country reported its second highest rate of infections and its deadliest day since the pandemic began, with 1,910 COVID-related deaths reported in just 24 hours. The Brazilian state of the Amazonas has been especially hard hit. A new variant first discovered late last year has led to a surge in new infections that have overwhelmed the healthcare system, which continues to experience widespread shortages of medical supplies, including oxygen. We are concerned about the situation in Brazil, and it provides a sober reminder of the threat of resurgence. Areas hit hard by the virus in the past are still vulnerable to infection today. And that's why it's important to continue to monitor the virus and to let data guide our actions. But we also cannot wait until our health systems are overwhelmed to implement public health measures. We must rely on these measures early and often to protect lives and our health systems. The situation with vaccines. I am happy to report that vaccinations continue across our region. More than 113 million people have received a COVID vaccine in the Americas as of this week, and more people are being vaccinated every day. Over the weekend, the Bahamas welcomed its first COVID-19 vaccines thanks to a donation of 20,000 doses of the AstraZeneca vaccine from the government of India. Peru has also received its first shipment of the Pfizer vaccines through COVAX. And last week, Colombia became the first country in Latin America to receive vaccines via the COVAX mechanism. Today, these doses are being delivered to at-risk groups, including indigenous communities in the country's Amazon region. Every country participating in COVAX has been informed about the number of doses that they will be receiving through May of this year. We've been very pleased with how quickly countries in our region have responded to COVAX agreements so they can begin to receive the 28.7 million doses that have been allocated to the Americas over the next 3 months. Over the last week, our revolving fund has been working closely with member states to accelerate access to COVID vaccines. For over 40 years, the PAHO revolving fund has helped the countries of the Americas protect people and reduce deaths from vaccine-preventable diseases, including polio, measles, yellow fever, bacterial pneumonia, influenza, rotavirus, and human papillomavirus. Through the revolving fund, 41 countries and territories in the Americas have been able to pool their resources to purchase high-quality vaccines, syringes, and related supplies for their populations at the lowest price than they would receive on their own. This is solidarity among the Americas at its height. Our revolving fund represents the Americas within COVAX, and over the past week, our fund has been receiving country advance payments, signed agreements with manufacturers, and have placed orders on behalf of our member states and begun all the necessary preparations to deliver doses across our region. In those cases where bridge funding is required to access on a timely basis to COVID-19 vaccines, the revolving fund is working with countries to extend financial credits to facilitate the procurement process. Thanks to our collective efforts, nearly 2.3 million COVAX doses will arrive in at least 7 countries in our region in the next days and weeks, and other countries are not far behind. The challenge now is to continue to accelerate deliveries to those countries that have not yet received COVAX doses to ensure that this month that all countries receive their initial installments of vaccines. PAHO is not just focused, however, on delivering these first few doses. We are also looking ahead to what will it take to ensure that everyone in our region is protected and provided as much information as possible on the timing of allocated doses for April, May, and beyond. To accompany the delivery of vaccines, the organization is accelerating the procurement of syringes, personal and protection equipment to ensure that health workers across the Americas have the supplies they need to safely deliver COVID vaccines for months to come. Of course, it's encouraging that vaccines have started to arrive across our region. But because doses are limited, most people will still have to wait several months before they're vaccinated. And during this time, we must remain cautious and protect ourselves, our families, by continuing to rely on the public health measures that have kept us safe through the worst surges of the pandemic. The actions we take will determine how quickly the virus continues to spread, so we cannot let our guard down, certainly not now when vaccines are so close. PAHO is doing its part to help countries secure and deliver vaccines safely and as quickly as possible. But manufacturing limitations, low supply, and high demand for vaccines make this an uncertain situation. In the meantime, however, we need everyone to collaborate as we work to keep ourselves, our families, and our communities safe. Thanks.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. Now we have some questions that have been sent by emails to the Q&A and live. Please write your questions and include your name and your media. There are several questions from several journalists, Jacqueline Mineda, from El Punto, Milagros Barrios, from Peru, La República Perú, Mariana Barrios, from Venezuela TV. They ask whether we could provide more details about when countries are receiving vaccines from COVAX. Dr. Etienne, please.
Question, which is a much asked question indeed. PAHO's revolving fund and our procurement teams are working hard to ensure that the countries of the Americas receive as many vaccines as they have been allocated and as quickly as possible. So in the next few days, we know that Honduras will be receiving some 48,000 doses of AstraZeneca vaccines, and El Salvador is also due to get some 33,600 doses from the same manufacturer, SK Bio. Guatemala will receive some 81,600 doses of the AstraZeneca vaccine, and Jamaica will also receive doses of the AstraZeneca vaccine. We have also placed orders from Serum Institute of India for 135,000 doses of the AstraZeneca vaccine for Nicaragua and 228,000 doses for Bolivia. But more vaccines will be arriving in coming weeks, and we will be moving to ensure access to vaccines for all of the countries that are participating in the COVAX mechanism.
Thank you, Dr. Etienne. La siguiente pregunta.
The next question is in English from Caldin Joseph.
Observer Media en Antigua y Barbuda. Y dice, how does PAHO project the dissemination of vaccines will affect the return to some semblance of normality in the Americas, considering the impact of vaccinations on the transmissibility of COVID-19 and the questions about how long immunity will last after a vaccine is administered. Dr. Barbosa?
Thank you. Thank you for this question. It's very important, as our director has already highlighted, to understand that the vaccines will take some time to work to control the transmission. First, because most vaccines that are being used requires 2 doses. So the people will get immunized after the second dose, after 2 weeks, probably, or a little bit more after the second dose. So this will get some time to get people really immunized against the COVID-19. Second, it's expected that we need to have at least 70% of the population vaccinated in order to achieve the herd immunity that is necessary to control the transmission. For this reason, when you see even countries in Europe that have already vaccinated the 12, 15, 18% of their population with the first dose, most of them are adopting very strict public health measures to avoid the increase in the transmission, to avoid the intensive care units to be overwhelmed and other very important health impacts produced by COVID-19. So while we are trying to get more access to vaccines, it's important to understand that the first objective of the vaccine now is to save lives. For this reason, the most vulnerable groups need to be vaccinated first in order to decrease the mortality. But we can only think to becoming to normality when the transmission is fully controlled. So we need to keep all the public health measures, wearing masks, keeping physical distancing, avoiding closed and crowded spaces, and all the measures that we know and we have evidence that can protect against the transmission. About the duration of the immunity, we still need to have more data about this. When we are talking about vaccines, they work differently. So we'll need to get more data after 1 year, what is happening with the protection provided. So the producers are working to get this data in order to have a future recommendation about a boost, a third doses, all the recommendations that will be carefully reviewed by the SAGE, the Strategic Advisory Group on Immunization of WHO, and our Technical Advisory Group of the Pan American Health Organization to provide this kind of guidance. We will need more data, and this data will be reviewed very carefully to make the proper recommendation when the time is come. Thank you.
Gracias, doctor. Una segunda pregunta de Kadim.
Thank you, doctor. Another question from Kadim Choser. And the question is in English.
Updates on treatment regimens for critically ill patients? Dr. Alighieri?
Yes, thank you for this second question from Antigua and Barbuda. First, I'd like to highlight that Antigua and Barbuda is reporting on a daily basis its cases and deaths as required under the international health regulations. So it's an important point. On our side, what PAHO is doing, PAHO is updating on a regular basis the review of potential new treatments that are published in peer-reviewed publications following randomized clinical protocols. This live review is published on the PAHO webpage, and it's accessible to all clinicians and ministries of health and scientific societies for their use. The recommendations for clinical management of patients with COVID-19 have not evolved drastically during the last couple of months. I'd like to highlight some of these recommendations as the close follow-up of persons with risk factors, including comorbidities, the monitoring of the oxygen level in patients suspected or confirmed to have COVID-19, and the detection of any evolution of the clinical status of the patients that would trigger a transfer to an intensive care unit. The timely access to oxygen therapy is key for preventing respiratory complications, and the use of anticoagulants and the dexamethasone has proven to be effective for reducing the mortality in critical patients. So I hope I have answered some of the concerns of our colleague from Antigua and Barbuda. Thank you.
Muchas gracias, doctor. Ahora quisiera...
Thank you, doctor. Now I would like to give the floor to Gisela Salomon from Agencia AP for her question. Gisela, if you are hearing us, please over to you. Yes, can you hear me? Thank you. Thank you, Sebastian. I wanted to ask a question regarding Chile. Why has vaccination been so successful in Chile? Is there any reason why Chile is different in vaccination, in terms of vaccination, vis-a-vis other Latin American countries? Yes, Dr. Barbosa, could you answer this question? Thank you for your question, Gisela. The situation of the countries in the region of Latin America and the Caribbean are very different. They vary. Chile is a high-income country. Other countries are low-income countries. In other words, Chile has two important factors on its side. First of all, they have had probably good planning, and they have smartly used the resources they have to carry out bilateral agreements with some manufacturers. Chile is also a participant in the COVAX facility. So Chile has several options to access the vaccine, but I don't think that these same conditions were true for other countries in the region that do not have resources as Chile does, because they are not high income level countries. So for this reason, we believe that if all countries in the region need to make their own decisions according to the resources that they have available, if they have resources to have bilateral agreements. Several countries did that and also participate in COVAX, because COVAX is going to be accessible to all the countries. There are 10 countries in our region that have no resources to enter into bilateral agreements. Without COVAX, these countries, it will take them 10 years or more to receive the vaccine, but now these countries will receive the vaccine through COVAX without any payment, free of charge. And this is an advantage. Different countries in the region have different conditions, different situations, but PAHO is strengthening their immunization programs so that all countries are ready to start using the vaccine in the region in a major way. Thank you very much. Thank you, Doctor. The next question is in English from Jacqueline Charles from the Miami Herald, and it reads:
Announced in the Caribbean press that Venezuela donated $200,000 to Grenada for COVID-19 vaccine. This, of course, has created confusion given the ongoing discussions about Venezuela and COVAX. She's asking, has Venezuela made its down payment? How much exactly is required? What is the real issue, and what is your reaction to this news that it has given $200,000 to one country while others are trying to help it get vaccine access? Dr. Barbosa?
Thank you for this question. I understand that this donation from Venezuela to Grenada is a bilateral agreement among two countries that the PAHO is not participating. This is a sovereign decision from each country, and we also welcome solidarity. It's important that the countries that can make donations to other countries, donations of vaccines, donation of money to support them to strengthen their immunization. I think that all these actions are always welcome, because this is part of the solidarity among the countries in the region. Venezuela has not made yet the down payment to COVAX. It's around $18 million. We are working both with COVAX, and the PAHO is participating in negotiations in Venezuela. These negotiations are progressing very well, but it probably will take a couple of weeks to finalize them and to have some currently frozen funds from Venezuela able to be used to pay this down payment, so Venezuela can be included in the second deployment of COVAX vaccines. Thank you.
Muchas gracias, doctor. Tenemos la siguiente.
Thank you, doctor. We have another question in English about a report regarding ECLAC. Question says
that extreme poverty in Latin America reached levels in 2020 not seen in the last 20 years. Why did the pandemic have such a devastating economic impact on our region? And is there anything we could have done to lessen that impact? Dr. Etienne, could you take this question?
So thank you, and certainly let me acknowledge the critical work that ECLAC is doing in our region, and we have had the opportunity to work with them on several occasions. So when we think about the big picture impacts of COVID-19 pandemic on our region, there are two critical points that I want to make and that I think we should keep in mind as we look forward towards recovery and importantly, as we prepare for future pandemics. The first is that COVID-19 exposed the interdependency between health, society, and our economies. We've made that point several times. It is important to note that economic growth is built by a healthy population, and health outcomes are intrinsically linked to the strength of economies. COVID-19 ushered in a triple crisis: health, economic, and social. Some people say political as well. And this crisis ravaged our already weakened health systems, destabilized economies, and fractured social protection. So moving forward, we must seek to integrate our approach to health, social protection, and the economy, and in doing so to mitigate the impact of shocks from major health events like COVID-19. The second point that I'd like to make is that the deeply entrenched inequality in our region made the impact of the pandemic even worse. COVID-19 disproportionately affected the poor, the elderly, and those with underlying health conditions, and other groups that live in conditions of vulnerability with limited access to the social determinants, including health care. To effectively cope with health threats like COVID-19, we must focus on reducing inequalities, on eradicating poverty, and strengthening social protection and health systems, and really increasing the access to health care for everyone, regardless of who they are or where they live. This will not only bring us closer to realizing our vision of universal health or health for all, but it will accelerate economic growth and build more resilient societies that are better equipped to confront the next pandemic. And this is extremely important. We must prepare now that we can more successfully confront the next pandemic. Over.
Muchas gracias, doctora Etienne. La siguiente pregunta es de Rodrigo.
Thank you. The next question is from Rodrigo Rosales from El Expreso from Peru. And it says this: regarding vaccination, what countries have progressed quickly in their process of vaccinating their population? Are there studies that say that their citizens have achieved immunization? And also another question is if there are cases where there are people who have had negative side effects that have been severe. Dr. Barbosa.
Gracias por las preguntas.
Thank you very much for the questions. The countries in the region are making progress with vaccination, but as we all know, access is quite limited, and it will continue to be limited for weeks or months. So it is very important to guarantee that the countries can have their priority groups that have already been vaccinated, that the most vulnerable individuals to the disease or to develop severe forms can be vaccinated. That is to say, to use the vaccine in the best way possible. So all of the countries are vaccinating in connection with the availability of vaccines. In the region, we have the US, Chile, and the UK territories that are making great progress with vaccination as compared to other countries. It is important to underscore that this is the first dose. For most of the cases, we still do not know how many people have already completed the second dose. The Pan American Health Organization is collecting information from all of the countries and this information is updated on a weekly basis. We are going to have a dashboard with the information so that we can monitor and work together with the countries in connection with the progress being made. Certainly, the vaccine, we already have a great deal of information on the vaccine. We have more than 200 million doses that have been administered in the world. The vaccines that are being administered and the pre-qualified vaccines, or those that have the authorization for emergency use as determined by the World Health Organization, have proven that they are highly safe so far. There are no adverse effects. We haven't seen any severe effects, and the adverse effects are very similar to the other ones to the ones that people get with the other vaccines. Some pain in the site of injection, some sort of discomfort for 1 or 2 days, but that goes away without any need to see a doctor. The same thing that happens with other vaccines. So now we have a great deal of information to make sure to ascertain that the vaccines are safe indeed. The data on vaccine efficiency, based on what we see in some countries are starting to have some information. Israel in particular, which is the country that has a very high percentage of the population already vaccinated, and other countries such as the UK, allows us to see the positive impact of the vaccine on the reduction of the disease. These are early pieces of data, but in the same fashion as the efficiency data, the data that was used to request authorization, all of this allows us to say that these are efficacious vaccines. The vaccines distributed through COVAX are vaccines that need to be pre-qualified, or that they need to have the emergency use authorization granted by WHO. That is an additional guarantee on the efficiency and also the safety of those vaccines. Thank you. Thank you, doctor. The next question is by Sara de Ofilo from Brazilian, and it says,
experiencing its worst moment of the pandemic. Is lockdown the solution in a national collapse scenario? Dr. Aldigueri?
Thank you for this question from Brazil. This is a topic that we have covered last week during the previous Pan American Health Organization press conference. And we'll try to address the concerns of the journalist. As of yesterday, 9th March, Brazil has reported more than 1 million cases of COVID-19, including more than 266,000 deaths. This is the second country of the region in terms of reports after the United States. And as I said, as commented during the PAHO press conference last week, we have received reports from the Ministry of Health and from the states of Brazil of high incidence of cases, increase in terms of ICU beds admissions, and increase in death countrywide. This phenomenon has been observed in most of the regions of Brazil, including in the Northeast, Nordeste, the Midwest, and the South. 12 states during the last 2 weeks are reporting ICU occupancy rate superior to 85%. There are very few exceptions for these increasing nationwide trends. And these exceptions includes the states of Amazonas and Roraima. But these states were highly impacted by the second wave in January and February, and they are now reporting decreasing trends in terms of new cases and death. So Brazil is a large country with a large populations, and the patterns can be quite different from a state to another, and also from a municipality to another. In this context of nationwide increasing trends, PAHO strongly recommends the implementation of public health measures, the very strict implementation of public health measures. And we are confident that the health authorities would strictly implement them, monitor them, and assess them. These public health measures have proven to be effective to curb transmission in similar context. So I hope that I have answered the concerns of the journalist. Thank you.
Muchas gracias, doctor.
Thank you very much, Doctor. Now I would like to give the floor to Melina Ochoa from TV Mexico. Melina, can you hear us? You have the floor. Good morning. Can you hear me? Yes, good morning. Please go ahead. This is Melina Ochoa with TV in Mexico City. In Mexico, 8 states have indicated that Sinovac, the Chinese vaccine, arrived at a temperature that is 3 degrees higher than recommended. Could this be negative for the vaccine? What is the recommendation by PAHO in connection to vaccine handling? And does PAHO think that there will be a third wave of transmission of COVID-19 due to the spring break or Holy Week? Thank you. Thank you, Melina. Dr. Barbosa. Thank you, Melina, for these questions. Let's see. The Sinovac vaccine that has arrived to Mexico is not a vaccine that is provided through COVAX. The vaccine producer, that is the Sinovac producer, is having some talks with the WHO to provide the information so that we can assess the vaccine and also to make a decision on its emergency use, but we are not there yet. So the fact that that vaccine is being sent to Mexico due to a bilateral agreement leads us to think that the regulatory authorities, COFEPRIS, as well as the Ministry of Health, the Secretariat of Health, should have all of the producers' information to be able to assess that is to say, the temperature differential. When the manufacturers work on the vaccines, they carry out tests, and they also include the possibility of the vaccine to be at a temperature a little bit different from recommendation. That changes with the vaccines. Some vaccines are more stable than others. We're talking about different products that have a technological platform that is quite different. So the party to provide you with that information would be the Secretariat of Health of Mexico as well as COFEPRIS, because they do have the information from the producer of that vaccine. At any rate, I'd like to take this opportunity to underscore the importance for all of the countries to be able to see the proper operation of their cold chain and transportation means. PAHO is working with the countries on the assessment of cold chains because this is a significant part of an immunization campaign. As to the possibility to have a third wave, yes, unfortunately, since the virus is still circulating and there is transmission whenever we let our guard down, and if we have people that go out to the street without any type of masks or protection, people are getting together in large numbers. People are going to homes indoors, and that may lead to an increase in transmission. So that is the reason why it is very important for Easter week or spring break, as you may call it, to have individuals to continue to maintain all of the measures. The virus is in all of the countries. The virus is circulating. The risk to get infected and to develop the disease is quite significant. We need to maintain all of the measures to avoid for that transmission increase after Easter, as we have seen in several countries due to Christmas, Carnival, and others. So whenever we let our guard down and the conditions are ripe enough to accelerate transmission, the virus takes advantage of those opportunities and again starts to circulate stronger. Thank you. The next question is from Ecuador. Maria Largacha and Gisela Roja from Ecuavisa. They are saying that in Ecuador, the list of vaccinated individuals will not be made public, and they would like to know whether for transparency reasons, the list of the vaccinated individuals should be made public or if that would be a violation of their privacy. Dr. Barbosa, would you please address this question? Thank you. All of the individuals have a right to privacy. I think that even patients, whenever they visit a doctor or whenever they are going to be administered a vaccine, they need to be protected in terms of privacy. I think that the concern expressed by the journalist as well as the concern of many others is to guarantee that this vaccination strategy is being complied with. That is to say that the most vulnerable groups are vaccinated. And I think that information can be obtained without violating or breaching people's privacy. I think that the states can share their vaccination plans in a transparent fashion with the community. We support all of the countries in the development of those plans. We also presented recommendations as to the priority groups to be vaccinated. First, health workers who are at higher risk of being infected because they are in contact with the patients. Next, vaccinate those groups that are at higher risk to develop severe forms and also die of COVID-19, the elderly, individuals with chronic diseases such as diabetes, hypertension, heart disease, cancer, and other conditions that may increase the risk for those chronic conditions. I think it is very important to have accountability from the ministries of health of the population so that the population can trust the vaccine and the immunization campaign. That is to say, to see what groups are being vaccinated so that the solidarity of the society with the higher risk groups may maintain this trust of individuals in vaccination. But as to public lists, I don't think that this is the best way to guarantee this situation and also to have updated and transparent information regarding the groups that are being vaccinated. Thank you. Thank you very much. Doctor, we have two questions in connection with variant. One is from Blanca Valadez from Mexico, and the other one is Efecto Concuyo from Venezuela. Mariana Blanca is saying that in connection with the variants detected in California and New York, what is their impact on the viral load and also the lethality and vaccine efficacy? And the second question is about the P1 variant that has been circulating in Brazil. We hear that this is more lethal than the other variants, and she would like to know what information is being handled by PAHO in this connection. Dr. Aldigueri, thank you very much for those two questions by Mexico and Venezuela, I believe, if I heard correctly. So in connection with the variants that were initially detected in the U.S., so far we have not received from the U.S. government authorities, from the health sector, any preliminary information as to the transmission of the variants, and the research continues.
In English, variant of concern.
These are not variants of concern or the most concerning variants at this point in time. At this point in time, we're thinking of the 3 variants of concern. That is the initial one that was detected in the UK, the one detected in South Africa, and the one detected in Brazil. As to the second question from Venezuela, this is in connection with P1, the one detected in the Amazon state, and we have several publications, including from Fiocruz in Manaus, that have provided us information regarding that variant and the genetic and molecular aspects. But currently, the research continues in Brazil in connection with the severity and also the virulence of that variant. For transmission, preliminary data seem to indicate that it has a higher rate of transmission, but once again, this has to do in comparison with the variant discovered in the UK last year. As to the severity of the variant, we do not have any finalized studies or preliminary data that would support the hypothesis of being more severe. It is important to mention that we have several teams within PAHO working in several states in Brazil to support the response in the states in January, February. This was more in the northern area of the Amazon basin, and also to focus on this topic. It is important to refer to the expansion of the laboratory network at the regional level. Mexico, Venezuela, and many other countries are part of that regional network for genomic surveillance that is being coordinated by PAHO. Venezuela did report P1 in several states, but this is the same situation in Colombia, Peru, and French Guiana, other countries that share the Amazon basin. Once again, I would like to underscore the importance of connecting reference labs so that they can share information in real time by using the GISAID platform, for example. And also the reference laboratories worldwide are uploading their information to this platform, and also wait for scientific information or research to give us more data in connection with these research hypotheses. And I hope I have addressed the questions presented by the colleagues in Mexico and Venezuela. Thank you. Thank you, Doctor. The next questions, we have two. One from Ariel Bogla from Tribune, Bahamas, and another one by Claudia Rebasa from CNN Spanish, and it has to do with the vaccines in the emergency list presented by WHO.
Johnson has submitted for emergency use listing to the WHO for the investigational single dose. Has WHO given the seal of approval for this vaccine and PAHO's thoughts about that? Y Claudia Rabasa de CNN en español, también en inglés, pregunta, when do you think there will be a revision for China's Sinopharm and Sinovac vaccines by the WHO? Doctor Barbosa, ¿podría contestar?
Yes, thank you for this question. The Johnson Johnson vaccine has submitted the full dossier to WHO. So this is the review process is in progress. This is a joint assessment between the WHO pre-qualification team and the European agency, the EMA. We expect that until next week, this process will be completed. So this will be good news because you have another producer, Johnson Johnson has already committed vaccines to COVAX, but these vaccines will be available probably late June or early July. But it's good news because it's another producer that will provide many doses to COVAX facility. And we expect soon to have this process completed. The two Chinese producers, Sinopharm and Sinovac, they started the process. With these producers, the process is taking more time because they are new producers. They don't have any previous vaccine for other diseases that were pre-qualified by WHO. So the process had to start from the first step. WHO sent a mission to China to perform an inspection in both producers. This inspection now is completed. Sinopharm has already presented the dossier. Sinovac is still pending some information. But the idea is to receive the dossier to make the assessment as WHO pre-qualification team is doing with all producers, and maybe by the end of March or April, we will have this process completed. It's important to highlight that it's not only WHO that needs to expedite the process. Sometimes the WHO pre-qualification team needs more information from the producers, and they ask the producers to provide this information in order to assess the safety and the efficacy of the vaccines. So it's the WHO pre-qualification team is working on this, and all producers are welcome to present their data because this will represent that we will have more producers delivering vaccines through COVAX mechanism. But they need to comply with exactly the same criteria to ensure safety and efficacy. Thank you.
Gracias, doctor. La siguiente pregunta que nos
Thank you,
llegó-
Doctor. The next question that we just received from Noel Perez Miranda from Article 66 in Nicaragua is that the Ministry of Health has already started vaccination with the vaccines donated by Russia, but also they are asking for a document to be signed so that there is a release of responsibility or liability, and this has to be signed by the ministry for accepting the vaccines. Dr. Aldigueri, thank you very much. The answer is that the countries can make their own decisions in terms of their liability during vaccination, but the use of this type of document is not one of their recommendations by WHO when we're talking about health services that are impacted by the vaccine. This could have an impact also on the agility of the process and also the distribution of the vaccine. Our aim is to facilitate, together with the ministries, a prompt and efficient distribution of the vaccine to attain coverage of risk individuals in remote areas that are difficult to access. Nicaragua has a very long history in terms of the implementation of an expanded immunization program that was very efficient, including in the most remote areas of the country. Nicaragua has presented a mechanism to distribute the vaccines through COVAX with cold chain information systems and surveillance. And I would like to say that the Managua team is working also very closely with the MINSA immunization program and with all of the authorities. I hope I have addressed the question in connection with the situation in Managua. Thank you, Doctor. The next question in English is by Paula Dupras Tobias from the New Humanitarian. The question is,
for indigenous people in the Amazon, where the situation has been dramatic regarding the pandemic, to be vaccinated. I understand, she says, that indigenous leaders from the region will be meeting with PAHO next week. Should the communities receive vaccines through COVAX? Dr. Barbosa?
Thank you for this question. The vaccines through COVAX are being deployed to the Ministry of Health. And the Ministries of Health in every country have established their national immunization program with the strategies, with the priority groups. PAHO has worked with the indigenous people. Since last year, we had many meetings in each country. We had sub-regional meetings. We had a high-level regional meeting calling the attention for the specific needs of this vulnerable population that we have in our region. We recommended that in some countries, the indigenous people should be part of the priority groups. And we received some national immunization plans that have included the indigenous people among the priority groups. So this is very important, especially the indigenous people that live far from health centers that have limited access to vaccines. Some countries are organizing missions to deliver the vaccines to them. This is important. Of course, we have limited access. The situation in each country is different, but this population should be included in the priority groups because they are more vulnerable due to the conditions that they live and the limited access that they have to health services. Thank you.
Muchas gracias, doctor. Y ya estamos llegando al final.
Thank you very much, Dr. Barbosa, and we are reaching the end of this media briefing, and we have a question from Bahamas Tribune. Mr. Douglas.
COVID-19 vaccines, are countries out of the woods and return to some level normality pre-COVID? What challenges we still face outside of vaccines, and what's your message to governments on managing their expectations? Dr. Etienne?
So thank you, Sebastian. Thank you, Ariel, for this question. As we have noted, the COVID pandemic is the worst public health crisis of our lifetimes. This morning, I told you that in our region, more than 1.2 million people have died, and more than 52 million have been infected. What we do know is that countries took and are continuing to take unprecedented measures to protect their people from becoming infected and overwhelming their health systems. But the truth is that some of these actions have severely impacted our economies. And we made the relationship before with health and the economy. So, as we said, no country is out of the woods when it comes to the COVID-19 pandemic. We all remain vulnerable to getting infected. So yes, 40 countries in our region have introduced COVID-19 vaccines, but we will need more time and more doses to reach the millions of people who want to be protected against this disease. So really, we believe that it will take us a long time to reach and return to normality. And we're not sure how long it will take or really what that normality will look like. Until a majority of our population are vaccinated, we urge you, we need to maintain the public health and social measures that are in place that can help us control the spread of cases. So it remains urgent to continue these public health measures, including social distancing, wearing of masks, and washing of hands often. And countries should continue to test, isolate, trace, and quarantine. And even if countries relax restrictions, people must remember the 3 C's. Avoid closed spaces with poor ventilation. Crowded places with many people nearby should be avoided. And close contact settings such as close range conversations should be avoided. Let us all come together to ensure that we can see the end of this pandemic. But it is only by ensuring that we take those public health measures, that our countries continue to exercise the public health measures that we know work. And with this, we will get to some semblance of normality, but this is going to take time. Thank you.
Muchas gracias, doctora Etienne. Ahora sí.
Thank you very much, Dr. Etienne. Now we have reached the end of today's session. You can find more information on PAHO's website, and you can continue to email us. Thank you so much again for being with us today. And as Dr. Etienne said, let's continue to take care of us. Thank you. See you next week.